The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, how to make a tooth in a day. It's a new kind of dentistry, a healthy approach. With us, we have Dr. Carlston. Dr. Carlston, welcome to the program.
Thank you.
Big topic, biomimetic dentist. Did I say it right?
That's correct.
Now, what is that?
Well, the term bio, of course, implies biology. Mimetic implies to mimic. So we attempt to mimic the natural tooth structure as much as possible when we're restoring the diseased portion of the tooth.
Okay.
So we remove only that part of the tooth that's diseased whenever possible, and we restore it with that material that most closely mimics that part of the tooth. For example,
is there a crowd out there, by the way, that are looking for this kind of a healthy approach to dentistry?
More and more. Dentistry will be driven to a more conservative approach by the public.
Conservative meaning what?
Less invasive work, removing less tooth structure while restoring. We now have the adhesives and the materials that allow us to mimic the tooth as we restore it in a very conservative fashion, as opposed to covering the entire tooth with a metal reinforced crown. We can avoid that in most instances now.
Now, you're one of about 5 guys that do this biomimetic dentistry in the world?
No, there are.
Or just in the United States?
In the United States, if you go to the web and look for biomimetic dentist, you'll find a half a dozen sites. There are more than that who have been trained in this field. Biomimetic dentistry eventually will be the norm in dentistry. But
you say it's a discipline?
Absolutely, it's a discipline.
Really?
It's a very, very intricate.
It's a healthy way of
restoring the tooth. Yes, we're
talking about crowns, by the way.
Yes, crowns and just regular restorations. If you're trained in biomimetic dentistry, you avoid as nearly as possible placing a full coverage crown on the tooth because it's very invasive. We don't want to destroy the natural flex of the tooth. When you have a natural virgin tooth that's never been worked on, there's a flex to it like this as you're chewing it. Just like as you're driving down the street.
So it moves a little bit.
Exactly. As you're driving down the street in a car, you have a shock absorber.
Okay.
And the same thing with the tooth. The tooth actually flexes as you chew on it. And when you cover the whole tooth with a metal reinforced restoration.
With a crown.
You destroy all that flex. And so while the patient is chewing, the flex is gone.
So what's wrong with that flex being gone?
It's transferred down to the gum line and causes it to break down. That's why the average crown only lasts 6-7 years, because it breaks down at the margins. The bacteria get up underneath those margins and cause recurrent decay.
Okay, now we've talked at length about this.
Yes.
I heard about it. I said I've got to have him on the show. Sometimes our show airs nationwide. I always feel like I've heard everything, but this is really a kind of a different slant, different what I normally hear. So crowns are being done every day.
Thousands
a day. Let's just say in LA, right?
Yes.
Like tens of thousands probably every day. You say there's a better way.
I
mean,
say,
to somebody watching this, they know they have to get a crown. You say get a second opinion possibly. Look into biomimetic dentistry. But what's the difference? I mean, what's the difference between traditional crowns and what you're doing?
When a patient comes to me, I can avoid a crown 90% of the time.
Really?
Absolutely.
Okay.
Because we have the adhesives now and the materials that can bond to the tooth. So we only have to remove that part of the tooth that's broken down.
So just the top?
Yeah. If the decay is down deep into the dentin, we restore that part of the tooth with a material that very closely simulates dentin. It flexes like dentin, it compresses like dentin, and so that's what we use in the dentin to restore that. And there's a very specific procedure and sequence where you add these adhesives and these materials.
So now you call it a skull cap. It's a skull cap on the tooth rather than covering the whole thing. Okay.
We don't like to take the margins and move them all the way down to the gum line.
So what's the benefit to the patient, though?
The benefit to the patient is that you retain the flexural nature of the tooth, that shock absorber, that natural shock absorber.
All right.
That's the benefit. So the tooth lasts longer. When and if this skull cap fails, it fails up on top. So you can get at it and restore it. When the crown fails, it's down here, and you have to, the new crown, you have no choice but to replace it with a new crown.
I didn't know that. Crowns only last about 8 years.
The average
they can last longer.
Well, they can, oh yes, I have patients who've had crowns for many years in their mouth.
I don't have any crowns, but is it true that you get a lot of, over time you get the gums, what do they, kind of fade away? What's that called?
Yeah, the stress of chewing causes all this flex to cause the recession of the gums. The gums shrink away, exposing the
So you
root.
don't get that with...
Well, you can get it over time because that's a natural function of aging.
Okay.
But with the margins way up in the top of the tooth and restoring, preserving all of the rest of this tooth structure,
okay,
you've got a much longer durability of the tooth, and so you're able to retain your teeth longer.
Is that right? Okay, now